This video will demonstrate a forward pipetting technique with a two-stop variable volume micropipette. Ergonomic principles are to be followed throughout the process, including supplies being at comfortable working distance and level. You should not be reaching. Your arms, shoulders, and elbows should be relaxed and not elevated to decrease arm fatigue. Your elbows should be kept close to your sides and resting on the counter when possible. Keep wrists straight or in a neutral position with a relaxed grip. Good posture is maintained with both feet on the floor. We will begin by choosing the correct micropipette needed to deliver the appropriate sample volume. For this example, we will be transferring 100 microliters of specimen to a clean test tube. When selecting the appropriate micropipette, look at the delivery volume range that is listed on the side of the micropipette. Select the micropipette with a maximum volume closest to the desired delivery volume that will be transferred. In this example, the desired delivery volume is 100 microliters. The pipette that will deliver the closest volume is the 10 to 100 microliter micropipette, not the 100 to 1000 microliter micropipette. This is the smallest volume pipette that will transfer the desired delivery volume. Set the delivery volume by using the push button on the top of the micropipette. To increase the delivery volume on this pipette gently, without using too much force or speed, turn the button counterclockwise. To decrease the delivery volume, gently turn the button clockwise. Do not turn the button past the lowest or highest setting. This can mess up the calibration of the pipette. An audible click indicates the volume is set correctly. The desired volume will be visible in the display window. For the pipette to function properly, the lubricant within the pipette needs to be redistributed to allow for the appropriate movement of the piston within the micropipette. Hold the pipette in your hand with a light grip with your thumb on the operating top button. With your thumb, depress the operating button through the first stop, then the second stop using slow and controlled movements. Repeat this 3 to 4 times. Continue by gently placing a disposable pipette tip on the end of the micropipette. The pipette tip should fit securely. Inspect the tip for any irregularities. If the tip appears damaged or irregular, discard and replace the pipette tip. Pre-wetting the pipette tip is an important step. A dry pipette tip can deliver a lower volume than a pre-wetted tip, resulting in an accuracy difference of up to 2 to 7%. Pre-wetting the pipette tip increases the humidity within the tip, which decreases evaporation within the tip, resulting in the correct delivery amount. Proceed by uncapping the specimen, opening away from your face. Hold the pipette vertically and depress the operating button to the first stop. Immerse the micropipette tip approximately 2 to 3 millimeters into the specimen. Slowly release the control knob to the ready position and wait 1 second. This will cause the sample to be aspirated into the pipette tip. Remove the tip from the fluid, approximately 3 millimeters above the fluid level. Dispense the sample into the original container by depressing the control knob to the first stop, wait 1 second, then depress to the second stop. This will blow out the pipette tip. Before beginning the aspiration process, make sure all equipment and fluid to be pipetted is at room temperature. If there are temperature differences between the micropipette and the liquid, this will decrease the micropipette's accuracy. Depress the operating button to the first stop. Keeping the pipette vertical, immerse the micropipette tip approximately 2 to 3 millimeters into the fluid. Slowly release the control knob to the ready position and wait 1 second. Do not allow the control knob to snap back. Remove the pipette tip from the specimen, gently tapping the inside of the container to remove excess fluid from the outside of the tip. Do not wipe off the tip with a tissue. Recap the original specimen container. Check the pipette tip for bubbles. If bubbles are present, dispense the specimen back into the original container and perform the aspiration process again. To dispense the measured specimen, place the tip containing the measured fluid inside the receiving vessel without touching the inside wall to approximately 1 centimeter from the bottom of the vessel or fluid level. If there is fluid in this receiving vessel, the pipette tip should not come into contact with the fluid. Dispense the sample into the receiving vessel by depressing the control knob to the first stop, then depress the control knob to the second stop. This will blow out the pipette tip. Touch the pipette tip to the inside of the receiving vessel, keeping the control knob in the second position. Gently remove the tip and the pipette from the receiving vessel with the control knob in the second position. Slowly release the control knob to the ready position once it is out of the receiving vessel. Dispose of the pipette tip in an appropriate biohazard container. Pipette tip should not be reused.